Type 2 diabetes develops gradually as the body becomes resistant to insulin. This makes blood sugar levels rise. But screenings can diagnose prediabetes and give you the chance to prevent or control full-blown type 2, so you avoid potentially life-threatening complications. The American Diabetes Association recommends you have a blood test to check your glucose levels every 3 years starting at age 45, especially if you're obese, have high blood pressure, or are physically inactive. The recommended diabetes screening is an A1C, or glycosylated hemoglobin test. It determines your average blood glucose level over the past 2 to 3 months. A result of 5.7 to 6.5% indicates prediabetes. Higher than that means you have full-blown type 2 diabetes. The fasting plasma glucose test has been the most common diabetes screening and is still used by some doctors. A result of 100 to 125 milligrams per deciliter indicates prediabetes. A level of 126 milligrams per deciliter or higher means that the test must be repeated within the week for an official diagnosis of diabetes. The oral glucose tolerance test requires you to fast for 8 hours and then drink a glucose solution. 2 hours later, your blood glucose level is measured. If the result is between 140 and 199 milligrams per deciliter, you have prediabetes. A result of 200 milligrams per deciliter on 2 tests confirms the diagnosis of type 2 diabetes. During a standard physical, a doctor may use the random plasma glucose test. A combination of diabetes symptoms and a result of 200 milligrams per deciliter or more indicates type 2 diabetes. A diagnosis of type 2 diabetes is discouraging at first, but you can live well with the disease if you manage it with diet, exercise, and medication. Watch more of our type 2 diabetes videos to get details about treatment.